Good morning. I'm on my way to my colonoscopy day. I perform colonoscopies and upper endoscopies. By the way, my car is driving. This is a Tesla, so don't panic. Colonoscopies are very important. If you're 45 or older and never had one, you need to have one. If you have family history of colon cancer and you're 40, you have to have one. Or I shouldn't say you have to, you should. Because people don't like to be told. And there's a lot of talk back and forth and fears. Well, let me give you a perspective. I've done uh, thousands of them in 30 years. I've been doing this since 1993. And uh, these colonoscopies, uh, people have fears that you're going to get a problem because all you hear is the problems, okay? And perforations. And oh, there's always a story that somebody had it and died. Well, first of all, you have to have a perforation or a hole in the colon, which usually happens after a biopsy or removal of a polyp. So you have to judge this, and sometimes the colon is thinner as you get older, and it can happen. The most important part is to recognize it early. Early recognition will stop the problem. What do you look for? Signs of pain. You're going to have discomfort, but should not have pain. After surgery, after the procedure, I'm talking about discomfort for the first 30 minutes or so. By the time you leave, you should not have pain. If you're having pain, you need to tell your doctor. Do not hesitate. Tell them. And if you have to exaggerate it a little bit. Get a CAT scan done and see if there's free air. If there's free air, you got to go to the operating room. As you know, I'm a surgeon. So if that happened to my patients, I would just uh, take him to surgery, put a camera, and usually because the colon is clean before a procedure, you can wash it, close the hole, end of story. In extreme cases, you have to make a resection. Very rarely, you have to do a colostomy. If you wait too long, you can get septic, can get very sick. It's like any perforation of the colon. So I would not hesitate to go take care of it um, if you have pain. But it's rare. Thousands, I don't have the exact number, but I mean, it's in the thousands, the high thousands, maybe 5,000. I don't know, more. I don't know. Doesn't matter. I'm very experienced, is the point. And in that time, I had two perforations. One was a big colon polyp, the other one was not so big. I recognized it intraoperatively and took him to surgery when they woke up, told them, look, we got to go, we have a problem. One of them, the polyp was pre-malignant, so uh, that was nice. The other one was not. These were older people too. So why older people? Because their colon is thinner. So that should not deter you because that is a small number. I should do this exact statistics, but it's less than 1% in the United States. Um, Surgeons do them, gastroenterologists do them. You may say, why does the surgeons do it? Well, we started doing colonoscopies before anybody did. Why? Because we handle colon cancers. GI doctors started doing them. They do more now, way more, because that's what they do. I operate and I do colonoscopies. I do them on my patients I operated on before, or sometimes I detect people that have not had it and I offer it to them. So do the colonoscopy. The color guard is good in between if you want to. It doesn't always detect what we're looking for. And remember, this is about prevention, not about early detection. We want to prevent that polyp from being a cancerous polyp. So uh, take care of it.